Recently, charges were brought against 5 people in the death of actor Matthew Perry for wrongfully providing him with ketamine. The news coming as a reminder that mental health struggles belong in the hands of trained, licensed, and vetted professionals. Charles Miller is a regular guest here on 3+U. As you know, he has Scenic City Neurotherapy, and yes, they do use ketamine to help their patients, but we had this conversation once before about the dangers of people not coming to someone trained as you are, but getting it essentially kind of off the street. So good to see you.
Yeah, I'm glad to be here. I'm glad we got to talk about this. Yeah, so self-administration of any anesthetic is always a bad idea. And when we say it like that, people are like, well, obviously, yeah, we shouldn't give ourselves anesthesia. Bad things can happen. Things should be done a certain way. Medications like ketamine are very powerful. They're very useful for many different reasons. Ketamine is one of our primary anesthetics for children 6 months and older. It's our safest non-opioid, non-narcotic anesthetic we use in surgery every single day. But it has this off-label effect for mental health and for many different chronic pain issues, but it has potential for abuse like every anesthetic does.
Well, so you had mentioned that if you are self-administering, I think is what the word you used, bad things can happen.
Yeah.
Bad things can happen too if people don't understand the topic as it truly is, because what was happening in the Matthew Perry case and what you do in your office every day are not the same thing.
Oh, no. This was unfortunately a case of abuse, and it, just like with most areas of abuse, people don't feel like they're abusing something, especially in the beginning. I mean, he'd worked a long time. He'd worked with, Matthew Perry, I think he had a very public struggle with addiction, specifically with like opiate-based medications. And this has been something that we have been trying to kind of get out there for a long time, is that even though ketamine is our safest anesthetic, it comes with inherent risk if administered in the wrong doses, or administered too frequently, or administered in unethical ways. And in this case, out of the 5 people that are being charged, I believe 2 of them are physicians who acquired, through using their DEA, these ketamine,
Right.
and just handed it over to a patient who didn't have the training or the understanding or the ability to protect himself.
So we have had some conversations lately. I was over at your office actually, and we talked for a while, and we tried really hard to make the focus mental health and not ketamine, because really your initial approach to somebody, the root that you're trying to help with, is that mental health struggle, and making people know that you're not judging when they walk in the door. It's a disease like any other, and they should feel no shame.
Absolutely. Ketamine is just one of the treatments that we offer, and it is a process. There's getting ketamine, which you can get ketamine in many different ways for many different reasons. But then there's ketamine infusion therapy, which is an entire process. It's a series of infusions that meet certain protocol standards that are always done in a very specific way to promote efficacy and safety and patient comfort. Then there's people who just take ketamine. If you're administering it to yourself, you're not doing ketamine therapy. That's not how this works.
Well, okay, let's talk about the therapy side of it, because you and I were chatting off camera about some other professionals in the area, and you would say, oh yeah, I know him, he and I work together. Oh yeah, I know him, he and I work together. So it is kind of a team approach.
Oh, absolutely.
So if you come to you and let's say that you've been struggling with PTSD, and maybe you don't really have anyone in your corner, you will help them find a mental health provider so that while they're seeing you for one side of the therapy, somebody else is helping them on the other side.
We're just helping the brain wake back up to where it can feel everything correctly, to where we can return the brain back to what's happening in the moment instead of the brain being attached to something that happened a long time ago. That's what we do, is the physiology. It's not the thinking component. The thinking component is not the underlying issue. The physiology, it's like, we use the analogy a lot, running with a broken leg. It's like you're training, you're doing all the work. If you could think your way out of it, you would have, but that's not possible.
Is there a general rule of thumb about how long it typically takes for that healing to begin?
Usually within the first few weeks, we have made 60% of the progress towards complete remission. And within anywhere from 3 months to 6 months, we usually have the patient at a point of remission of symptoms.
So let's say that is, I'll go with the PTSD scenario again, and let's say it's, a situation where someone's having sleepless nights and it's really affecting their quality of life. Basically, they could come to you, and at the end of a 6-month period of time, give or take, and working hand in hand with another mental health provider, those sleepless nights would be pretty much over?
Think of it like, well, it depends.
Yeah.
There's other variables that go into that. But making sure that we have done everything we can to address the physiology in the brain, to where the brain can adapt, take in and retain information, because that's an unconscious piece of our brain. We don't choose to feel bad. We don't choose to feel good. They're reflexes. Like, that's what emotions are. It's like,
I see.
And what we do helps them to feel correctly. And then what they do with psychotherapy that follows is make sure that what they are doing in their day-to-day life promotes the good mental health they want to feel.
So at the end of that 6-month time frame, understanding each case is its own, I'm not trying to like pin you to the wall on that one, but does that mean then that they're kind of good to go, or do you ever have to come back and kind of do a follow-up?
People come back periodically. I would say it's maybe about 50% of patients will come back at different points. Different life struggles come up, different bumps in the road happen. As we go through our.
But life. Not always for that same 6 months, because they're stronger.
Oh no, it's usually just a single booster, and then off
Okay.
they go again. Because what we do doesn't go away quickly.
We never have a quick conversation, but I always enjoy it when you're here.
I always do too.
So don't let the headlines that you've seen keep you from seeking the help that might be very beneficial for you or someone in your family who you know and love. It's Scenic City Neurotherapy. Their information there on the screen, 228-0579. And by the way, they are open on Sundays, closed on Saturdays, but they can help you 6 days of the week. Thank you.